Is your surgeon or the healthcare center where you are having breast cancer surgery offering quality treatment? Do you wish to know how to assess this? Experts have set certain criteria for breast conservation treatment. Have these been met by your surgeon or treatment center? In this video, I will be sharing one particular quality metric set by a professional body. Also, I will be reviewing the same metric reported at a few healthcare centers. You can then be the judge if a healthcare facility offers quality treatment and decide where you wish to have surgery, so stay tuned. Please note that presenting these quality indicators or standards for the treatment of breast cancer is solely for educational purposes and does not replace a medical consult. Please consult your doctor for treatment planning. Before we move to the published quality indicators, allow me to briefly state the options for the surgical treatment of breast cancer. There are two broad categories. The first is breast conservation treatment. This involves the surgical removal of the cancer with a rim of uninvolved breast tissue all around. Surgery is usually followed by radiotherapy to the remaining breast. The other group of operations involve mastectomy, which is the removal of the breast. Patients may choose to undergo breast reconstruction after mastectomy. Since 1991, there has existed a consensus statement from the National Institute of Health in the United States that breast conservation treatment is an appropriate method of primary treatment for the majority of women with stage 1 and 2 breast cancer and is preferable because it provides survival rates equivalent to those of total mastectomy. At the 2025 edition of the St. Gallen International Breast Cancer Conference, the expert panel that convened stated that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results. So there is a long history of experts recommending breast conservation treatment for early breast cancer, which usually comprises stage 1 and 2 breast cancer. Early breast cancer includes cancers which are smaller than 5 centimeters in size. Unsurprisingly, therefore, there are healthcare organizations which have drawn up quality metrics for the surgical treatment of breast cancer. A commonly cited one is that by EUSOMA, or the European Society of Breast Cancer Specialists. In this video, I shall be discussing specifically the quality standard laid down by EUSOMA for the surgical treatment of invasive breast cancer. Other metrics will be discussed in our other videos. Various healthcare centers have published audits of their breast cancer surgical treatment rates. Let's see how these match up to the standards set by EUSOMA. Allow me to begin with some historical data. In the year 2010, this group of experts from multiple centers in Europe compiled a list of quality indicators in breast cancer care. As mentioned, I will focus on the standards for breast conservation treatment. That year, by consensus, it was decided that the minimum standard for the proportion of patients with invasive breast cancer not greater than 3 centimeters should be 70%, with a target rate of 80%. In other words, at least 70% of women with breast cancer smaller than 3 centimeters in size should undergo breast conservation treatment. Let us now review some audits which were performed around the time this article was published. In 2008, prior to these quality indicators being published, a collaborative effort by German and Swiss experts had already taken the initiative to independently work out target breast conservation rates. We can see there was a consistent increase in breast conservation rates from 64% in 2003 to 70% in 2007. For women with cancer not larger than 2 centimeters in size, the target breast conservation rate was 85% in 2007. Moving on to audits performed after the 2010 EUSOMA quality indicators were published, let us look at this combined audit of several treatment centers in France. Specific to the metric of breast conservation rates of women who had breast cancer no larger than 3 centimeters in dimension, 80.8% of patients received breast-conserving surgery. Portugal also undertook an audit of key performance indicators in breast cancer management. In 2023, it was found that 81% of women in Portugal with stage 1 disease underwent breast-conserving surgery. The results from these two audits demonstrate that it is possible to achieve the minimum standards set by EUSOMA for breast conservation treatment on a countrywide basis. In fact, as time went by, EUSOMA updated their quality indicators, and as of 2024, the minimum standard for patients with invasive breast cancer, not greater than 3 centimeters in size undergoing breast-conserving surgery, stands at 85% with a target percentage of 95%. Is this rising trend of breast conservation treatment true for all institutions? To answer this question, let us look at the studies performed in other geographical areas. The first healthcare facility I'll discuss is a world-renowned cancer center. This team of doctors reported an increase in mastectomy rates instead of higher breast conservation rates. In 2013, the mastectomy rate at this institution was 59.9%, meaning that the breast conservation rate was 40.1%. You might have also noticed that this study was published in 2025, which was the year after EUSOMA updated their guidelines to the minimum standard of 85% for breast-conserving surgery. In other words, in this internationally renowned cancer center, breast conservation rates were 45% below the standard set by EUSOMA. If you wish to know which well-known center this data is from, or for more information on this article, you may choose to watch other related videos in this channel, or submit a request at the link given in the description. You will recall that in 2007, German and Swiss doctors were aiming for 70% breast conservation rates for all tumor sizes. This rate was supported by the EUSOMA quality indicators, which were published in 2010. During a similar era in Asia, we can see that the rate of breast conservation treatment, as shown by the dotted blue line, is below 50%. So there is a difference in Europe and Asia with respect to breast conservation rates. In 2022, at a cancer conference, this team of doctors from a country in Southeast Asia presented their work as a poster auditing the delivery of surgical treatment for breast cancer based on a joint national cancer registry from 2002 to 2016. The percentage of women who underwent breast-conserving surgery with radiotherapy was 53%, while there were an additional 3% of women who underwent breast-conserving surgery. They did not receive radiotherapy and were found to have an increase in local recurrence. So, as a breast cancer surgeon, I would exclude the 3% of women who did not complete their treatment in the analysis. Regardless, the percentage of women who underwent breast-conserving surgery falls below the EUSOMA guidelines published in both 2010 and 2024. Another point to note would be that this team of doctors found that women who underwent breast-conserving surgery with radiotherapy had superior overall and disease-free survival than those who underwent mastectomy. This certainly should be taken into consideration when counseling patients for breast cancer surgery, and should also be a strong argument for raising the breast conservation rate to at least 85% as recommended by EUSOMA. Is there a reason that breast conservation rates in Asian women tend to be lower? This is the breast conservation treatment rate published in 2014 by a surgeon practicing in Singapore, a Southeast Asian country. The data demonstrates that it is possible to achieve a breast conservation rate of 85% as recommended by EUSOMA in an Asian population, despite lower rates reported by other centers in the same region. The references to all these articles are provided for you to fact-check and verify the data and publications. For further details, please feel free to leave a comment or submit a request through the link in the description. Thank you for staying until the end of the video. We have covered only a single quality indicator listed by EUSOMA and related data from just a few centers. More such reports and surgical treatment standards are discussed in other videos, and I hope you will join me there too. Don't forget to like, share, comment, and subscribe for more related content. Until we come together again, take care.